Welcome to the Healthcare Nation podcast. We're committed to bringing you thought leaders in the field to discuss what's new and noteworthy in the healthcare sector. Now your host, Rick Gannotta.
Okay, welcome to the Healthcare Nation podcast. Your host here, Rick Gannotta, with our producer, Joe Woolworth. Joe, as usual, how are you, my friend?
I'm doing well.
Good to see you today. We got a lot to cover, and we're going to go into 2025 health sector and healthcare delivery predictions. Anything on your mind with respect to 2025?
I don't have any predictions right now. We'll see. We'll see how it goes with the show.
That's right. You might as we go along. But listen, what I wanted to do is just dive into what was new and noteworthy happening in the health sector cycle over the last week. And Joe, weigh in too. I'd love to hear your thoughts. I think first and foremost, as I record this, we've got a looming federal shutdown happening here. The House rejected Speaker Mike Johnson's proposal to extend funding. There's a lot going on. We got President-elect Trump and Elon Musk weighing in. If no resolution is reached by Saturday, the government could face temporary shutdown, furlough 45% of HHS staff, and hopefully would spare some major programs like Medicare, Medicaid, but they can always be impacted. So we shall see.
I feel this is a boy cried wolf thing. They always we're going to shut down. It feels like it's the only play they have left to get anything done.
Well, you think, we've got a new administration coming in. I mean, this happens, like you said, almost year over year. It's predictable. I think, unfortunately, what it does is it just reinforces this lack of trust that the general public, the citizenry of the United States have with the way folks can work together. So that's the most concerning thing for me.
Yeah, it's hard not to put it in the context of if I just got this shirt from Duluth. I like Duluth, the clothing company. If they were like, hey, if you guys don't buy clothes, we're going out of business once a year, it'd be like, well, I'm not really sure.
I'm never going to buy from you again.
You're going to make it,
It's true. Listen, I gotcha. On another topic, Make America Healthy Again, RFK Jr., they've got a caucus going now. Senator Roger Marshall announced a new caucus supporting RFK Jr.'s agenda. They're going to focus on improving nutrition, expanding access to affordable, nutrient-dense foods, addressing chronic diseases through primary care. All sounds really good. Yeah. This is the side of the coin where I say, look, RFK Jr., love him or hate him, there are certain things that I like, and I hope, even though when I look at caucus members, I have some concerns about some of their standings in past, let's just say, support of different policy issues. You can't argue with what I just said.
Yeah, I think people we have to choose. I forget who said it, but I was watching, I think it was Bill Maher. He was like, I did this last time when my guy lost. I'm not going to pre-hate.
Yeah.
I'm just going to go into it. Hey, this could be great. I can't believe they went with Make America Healthy Again, though, with all the division that MAGA seemed to cause to lean into that branding. But
yeah, that's it, right. That's a totally different topic for another show, but I get it. But it's catchy, and if you're in that constituency, you could see how it could easily co-brand to a certain extent.
It sounds like an evil laugh.
On the FDA front, interesting. I could say better late than never. I hate to say that because the FDA Commissioner, Rob Califf, I worked with him for a long time. He's a great guy. But they're redefining healthy food. The FDA revised its decades-old, that's right, Joe, decades-old definition of healthy to reflect modern nutritional science, about time. So foods like avocados, salmon, nuts qualify, while guess what? Sugary cereals and sweetened yogurts no longer meet the criteria. So no more of our Captain Crunch and
when did this happen?
Stuff. This is just recently. They're going to go ahead and in fact, it might even be a standardized symbol they'll have for healthy foods. That's in development, and I think a consumer guide. So this is as I said, better late than never.
Do you think they'll go as far as putting warning labels on certain sugary, bad for you snacks?
I think that is getting back to the MAHA movement. That's probably something we're going to see with the new FDA commissioner and some of those initiatives. But the current administration and current FDA, leadership is getting a jump on that. So,
do you think that works? Do you think anybody who smokes has ever been deterred by the Surgeon General's warning?
Yeah, I think it's more. We know smoking is bad, and I think most people now know. Hey, if you eat a bowl of sugar today, it's a very bad thing. It's just to get in this case, the FDA behind something like this. At least it's signaling that, guess what?
Yeah.
Science is real. There are certain things that are bad for you.
Yeah.
If we're going to get into the business of starting to enforce through the FDA certain mandates on products, drugs,
Sure.
even food provisions,
Absolutely.
they have to do this.
It's a great first step because you can't say stuff is bad unless you define what is good.
That's right. That's right. And as I've said many times, whose truth is it? But at least in this case, I think they're on the right side of a good thing. And as I said, better late than never. In the universe of emerging innovations, right? Big clap out to my friends at NYU Langone, the entire team there, surgical team, et cetera. 10 gene edited pig kidney transplant happened there at NYU. They transplanted a genetically modified pig kidney into a human. This has opened up incredibly new possibilities for addressing organ shortages. I hope this one sticks. It really is quite promising. I know they would not have been as public as they were with this in the scientific literature if they didn't feel like they were, on the positive side of a real potential breakthrough here. So that's really incredible news when we look at, emerging innovations and one of the big challenges in care delivery, which is the transplant space.
Absolutely.
In the policy side, bipartisan House Task Force released a 250-page report, outlined a vision for advancing healthcare AI. That's a good thing. I think particularly as we get into predictions, it's all about AI. It's all about large language models and how they're going to be, declaring themselves in the world of direct patient care, but I also think in the world of discovery and med tech, where it's always there, biotech as well. So
yeah, we talked about this topic before in the past. The idea that there's some kind of regulation happening is good. I wonder how much of the 253 pages was written by AI.
Yeah, we'll have to do that. I got a little program for that. We'll have to go backwards on that, but that's a good point. Merck jumping in, $2 billion bet on their weight loss drug. They have invested in licensing a new GLP-1 receptor from Hanos Pharma. I think I pronounced it right. This is going to have implications again for that sector and the cardiovascular metabolic market. So everyone's getting into it.
Any advancements on the drug itself, or is it very similar to the other stuff?
I don't know much about this drug, but I think every day we're seeing the GLP-1s have a positive impact on other areas. We know this with addiction, whether it be food addictions, but now alcohol, drugs, et cetera. We also see some beneficial, they're reporting some psychiatric and mental health attributes. So there's a lot happening in this space. We're going to see a lot more. We're just starting to get the economic data on I'll say the externalities associated with impact to, fast food and things like that. So a lot. Don't forget, this is fairly new when you look at the applications with respect to weight loss and how folks are using the off-label use of this.
Yeah.
Including microdosing GLP-1s, which is something that's really new and pretty exciting as well. Hopefully that will, mitigate the side effects that folks have reported with the usual doses.
Yeah.
Lastly, United Healthcare CEO murders fallout, the indictment of Mangione for the killing. Look, it's done everything from heightened security concerns that if you're playing in social media, there's something every other day, whether it's a song written up about, United Healthcare or the new focus, there is no doubt that there is renewed, I think, beyond interest, movement to looking at health care insurance, looking at how this is going to play out. We'll talk about it a bit in the predictions, but a lot more to come on that. But now, Joe, on to 2025. What do you think?
I'm ready. I'm ready for 2025.
Let's go for it.
All right, so we're going to talk about what might happen in 2025 in the healthcare industry. So why don't we start with a high-level summary of what we should expect in the coming year, and specifically, how do you think that the healthcare market is going to perform in 2025?
Okay, so kind of a general overview. Well, look, I think general overview, the delivery side, the market as a whole, as a sector, across the board, grow moderately. right? Despite the challenges that we've had, including still lingering post-COVID stuff with respect to everything from laws and regulations across the board to shortages, which we'll get into. But I think I am optimistic about the year ahead. I think we will be better than the year behind, 2024 and 23. But I think, as usual, there's certain themes that continue. One is rising operational costs. They will maintain, right? It's expensive. I think regulatory uncertainties, whether you say that would be good or bad under a Trump administration, but that might temper the optimism. We shall see. But I think that from a sector side, the innovation side, you're going to have to balance those investments in innovation with maintaining costs and having a good thing. And I think the same holds true for the healthcare delivery side. In general, I think that there'll be, like, let's say an 8 to 10% market increase overall with respect to costs. We'll see how that tracks with inflation. But look, drug prices, high demand for behavioral health, that's not going to stop. We've got to think about creative ways to address a lot of these pressures while maintaining care quality. But I am optimistic with the sector overall in general.
Yeah. All right. So to preface this one, I think about there was a time where every bit of new tech was vilified. Telephones were bad because whatever happened to writing a letter, it was. And now it seems like a great example, I think, of tech advancing and becoming normalized is Zoom during COVID. It was like the thing that nobody could figure. It was like the hardest thing to do. Like you try to get grandpa on Zoom. It's like, ha ha ha, that old Luddite, he can't figure that out. But now everybody can Zoom like nobody's business. It's fine. And speaking of AI, Apple put it in their phones.
It did.
And so I think the day of people being weirded out by AI is shrinking. And when I say weirded out, I mean the way that we are scared of things we don't understand. Because once people get the idea of, oh, it just summarizes my thing. Oh, it just helps me find something. Oh, it just does this little thing. I wonder if people's perceptions of it aren't going to change across the board, including its involvement in their healthcare. Like if it does something good for you, perhaps you're not so opposed to it. But I think the majority of people would probably be initially opposed to AI reading their medical records or having any access to it, just because we don't know. But I wonder if that's going to shift. So how do you think that artificial intelligence is going to impact healthcare delivery 2025?
Yeah, so let me start with a couple things that you said. I think just when we talk about search and Google, I'm going to Google something, Joe.
Right.
That's going to stop. It's going to be, I'm going to chat something. Because when
they just shipped it last week.
Exactly. So when you can interact in a natural language, manner and ask for something, get that response, that's it. So when it's just like, hey, Skype, what was Skype? Went to Zoom. Zoom, difficult. What's next? It's just like Googling, it's going to become chatting. I mean, that's what I think. And ChatGPT obviously is going to be in the market as a forerunner, but as you said, it's not limited to that. We got Gemini, all the other things, the Apple version. I think with respect to healthcare delivery, you're going to see an incredible move on the diagnostic side really fast. Before I get into predictions specifically, I would also say this. I think within the next 5 years, it will be, if you look at litigation and risk, if you didn't query a large language model, AI, to get some informed feedback that supported your differential diagnosis, that might even be seen as malpractice. Because let's just take oncology. You can't read 10,000, manuscripts a year or look at uploading all that clinical trials information and absorb that. But AI could, and if you don't query that, perhaps you would be missing something. When it comes down to specifics, I think adoption in 2025, we're talking about 2025, will be greater than 50%. We're talking like 60, 70%. It'll start with ambient scribing, not language, natural language, and doing histories and physicals. But I also think that in the diagnostic space, as I just described, workflow, patient engagement, predictive analytics for population health, AI-assisted surgery, in particular, when you look at synthesis of, say, images like MRI images into the surgical suite and surgical field, these technologies are going to be game-changing. We're going to start to see them, become part and parcel to everyday work in healthcare, starting with low-hanging fruit like pre-authorizations. We talked about United Healthcare and insurance in general, going through to accelerating step therapy, therapeutic substitutions with drugs. This will reduce errors, improve efficiency, and I think deliver more personalized, high quality, and affordable care. So, that's my prediction just on the AI side of things.
So kind of like the cousin of this, we seem to love getting more data about our bodies.
Yeah.
We got wearable watches. Those rings are becoming popular.
They are.
I swear if people could inject stuff into themselves, they would. They'd be like, new from Amazon.
Yeah, that's right. But it's consumer based, right? You can go there, you can buy anything off. The question is it a toy or is it medical grade? And will it give me a diagnostic quality, result or not?
So do you think there's specific areas in regards to the innovations around digital health technologies, especially in the private sector, that's going to start to show up in 2025?
Yeah, I think in the private sector, let's say even venture capital startup side, telemedicine, wearable health devices, remote monitoring, this is going to be the way we...
Do you mean like giving access to your information gathered from your rings and watches to your telehealth
Right. I think there'll be the passive acquisition of data that you allow through those wearables, like the ring, and other wearables to come, and the active kind of, I'm going to put this information in, those two things. But regardless, I think the shift is going to go towards more individual, I don't even want to say patient, I'll say individual engagement where people want to have agency over their own kind of healthcare and get into personalized health tracking. This is going to accelerate this digital health technology side. It's going to go hand in glove with this longevity movement that's happening as well. I know I'm getting off track a little bit, but I think that is, really advanced by folks saying, hey, what is my hemoglobin A1C? What is my H&A? How's my blood count look? What's the functional medicine profile? And how do I get that data? Well, a lot of it is going to be acquired through these wearable technologies. I think there'll be a tremendous move by the private sector to drive the advancements in that space. Now, in addition, I will tell you this, on the computational side, I think when you look at gene therapy, precision oncology, cell-based treatments, we know that startups are innovating in mental health with virtual reality therapy. Imagine a digital prescription for the virtual reality therapy, AI-driven mental health. That's really, I think, going to be an area that explodes. Mm. And we're seeing...
Are you saying that they're trying to pitch like having an AI bot rather than a human do talk therapy?
I think it could be talk that, yes. I would just say broadly yes, but also...
That's an emotional support companion.
Could be,
yeah.
but it could also be in the universe of desensitization, PTSD, when you think about that. I mean, we talk about the use of psychedelics. Think about virtual reality with scenarios and things. Now, look, I'm not an expert in that area, but I think this is where a lot of investment is going. Mm. And the last part is going to be, I also think in off-site, let's say, robotic systems and portable diagnostic devices that are going to be done. This opens up a whole new world for, non-physicians to start, deploying technologies in a way and in a space that might be remote where you'd need a doctor before. These are all areas where I have either seen folks working on or I've worked with folks who are in this space. And I think for 2025, getting back to that, these 12 months, we're going to see a lot of advancements.
Might see some advancements. Yeah. I think it's really interesting to think about stuff like that. Like chatting with somebody that's AI, you might think people would be like, oh, that's a terrible idea. But we don't know with new technology. People might be like, I'd much rather do that than talk to this lady that I'm talking to has a husband who works with my husband's cousin down at the old deli, and I'm worried that I can't really share with this. Yeah. Maybe people are more comfortable with it.
Could be sharing, right? Intimate information. Yeah. And we know this already, that in a survey that was done, this is a while, but it's got to be 2 years old. You and I talked about it. I think over half of the individuals who had an encounter with what was a bot had a better or equal patient experience than with their physician. That's old data, but they had a good, positive, view from a patient satisfaction perspective. So, again, there is a lot developing in that space where this is going to be ubiquitous in healthcare.
All right, so that's 2025. Good recap of what we think's happening with tech and innovation. Now let's switch to workforce challenges, another topic that we talk about a lot here. How is the healthcare industry addressing the workforce shortages coming up in 2025?
Yeah, I would say this. Here's my prediction. Not fast enough and not good enough. 2025, if we don't start doing something, it's going to continue to be more of a challenge. That's my prediction with respect to workforce. And I'll say this, look, shortages, particularly in rural and underserved areas, very acute. This is physicians, nurses. We know we need about 200,000 new nurses to meet demand. We've got to expand nursing and medical school enrollments. We've got to look at loan forgiveness for those, professions. I think models of care, and again, this is a prediction. I hope folks are working on this, using AI to reduce administrative burden, free clinicians spend more time with patients. But I think at the end of the day, what we really need to do, it's like when we talk about tech and think full stack. I want hardware, I want software, I want consumer facing, I want back office functions, I want the full stack. But we better think about that for the workforce as well. For instance, if I was thinking full stack for nursing, it's not only the competency of care delivery, understanding, oh, hey, they've got lungs that sound like they're wet. They might be going into heart failure and they're a little blue, cyanotic. I better act on this. They have to be equally as conversant into looking at data that's acquired from wearables, where maybe the patient is at home, right? And look for incremental improvements or decremental problems where folks might be going bad physiologically, and be able to act on it. What I'm concerned about is whether in nursing we're teaching that future state scenario where I think the model of care will be a nurse sitting in front of a bank of pretty sophisticated computers that display this information, and whether the patient is down the hall in a room or whether they are at home, they're able to act, at a distance on that patient, perhaps summoning teams in to work on that, et cetera. But it's going to be a very different kind of model, and I don't know that we're teaching for that. The same holds true for physicians. There are very deep shortages in certain specialties. I think that, if you overlay AI in the diagnostic space, what does this mean for physician workflow? What does it do for a surgeon? All of that's coming together. And if we don't get a handle on this, now I think it will be problematic. And 2025 is the time to do that, to kind of hitch the wagon to AI, to make sure that there's a thoughtful and very informed level of engagement with content experts as these platforms are being developed.
Yeah. I think, too, it's interesting to think about how all that data is there. Like right now, I've got my iPhone in my pocket, which has HealthKit, which knows a ton of stuff about me.
Yeah.
It can probably tell me some health things I should be looking out for, but they don't have that part of the code turned on. In other words, I don't get the text message that's like, hey, your O2 level changed and you're not sleeping as good and you're waking up at this time, and you probably have. It probably could do that, but it's just not turned on. Probably rightly so, because your phone shouldn't be talking. But the nurses are the ones that should be able to have the access to this to make an informed decision about what the next step is, because then it's not coming out of the blue. Like I'm not getting a text message like, hey, you're getting old. Yeah, I knew. Thank you for that.
Well, listen, I think this is the case. Right now, what you just described, if it was it could happen. It could absolutely say, hey, Joe, your gait is off.
Right.
Your oxygen saturation is different. You fell twice this month. There's something going on.
Sure.
I mean, it could do that.
Right.
It's just a question of, as you said, turning it on or turning it off. And what's the gating issue between that? A lot of it is regulatory. A lot of it is legal.
Right.
I think it is also I call it the grade, the quality grade. Is it medical grade acquisition of this information where it really is giving you accurate data, accurate parametric data that you can act on versus an anomaly? That's important, particularly if it was going to summon, say, EMS. But to your point, it can happen. It can happen.
But I was thinking probably the right people to interpret that data is not necessarily the user of, because it solves the permission thing too, right? It's not coming out of nowhere. I went to the doctor And that gets back to like the digital rights of that health information. Can we share that with them?
Right.
And I feel like most people, if given that opportunity, would, because a lot of times when you go and speak with a doctor or a nurse, you might get 4 minutes to describe what's happening with you.
It's true. Yeah.
And you didn't go to medical school. You don't know what's medically relevant, you know? And so you could be describing something that's not helpful to them at all.
But I think, probably what you're getting to here is, will there be the equivalent of, and poor way to describe it, a call center where all that information goes to, where someone then calls you and says, hey, Joe? I think ultimately it will. It'll be driven by AI. Now, who will own that? Will it be your insurance company that does that? Because clearly it would be more cost effective for them to deploy technology.
Yeah, if people became comfortable with it, the healthcare industry would make the devices.
They would do it, right.
It wouldn't be an Apple Watch. It would be like a
or it would be
Blue Cross
integration.
Blue Shield shot, just like.
Could be, but I do think the consumer space is where this is going to develop. It really gets down to, how much, again, agency we're going to allow an individual have to say, oh, it's telling me this. Now I need to go to my doctor. I think that's what we'll see first.
Yeah.
Now, there may have to be an attestation that you're saying, yeah, I'll use this. I know it may not be completely accurate, but we shall see. We started with the FDA changing their, nutritional kind of grid, and they just stood up a big AI section. Things can change. I think in the regulatory space, it'll change.
And
as well.
AI has been so rapidly developing. Like we could see significant jumps in 2025.
We're going to see significant jumps in 20. I think everything we talked about already, it's either happening or it is developed to the point where there's some deployable asset capabilities along the lines of what we talked to. It's really how the regulatory environment, how the economics, and how, honestly, the commercialization will unfold.
All right, so switching gears here. With Donald Trump returning to the White House, what does the future of the Affordable Care Act look like? So it's kind of going over to Medicare, Medicaid, care delivery. What do you think it looks like under his administration?
Yeah. Wow. Man, this is, talk about, now we're on a different glide path. But look, this is the healthcare nation. This is probably one of the most important aspects of healthcare that we talk about in healthcare delivery. Look, Joe, I think the Affordable Care Act is going to probably face some significant changes under the Trump administration. This is just a reality. We know this based on his history, things that he has said, things that his administration, in fact, the incoming folks have signaled as well. I think, will there be efforts to dismantle it completely? I don't know. I don't think so. But I do think revisiting the individual mandate, right? While the penalty for not having health insurance was reduced to 0 in 2017, could there be further efforts to weaken or eliminate the provisions that heretofore encourage coverage and access? Maybe. I don't know. I think on the Medicaid space, and you mentioned Medicaid, the administration certainly, I think, would pursue waivers that impose work requirements to reduce coverage under Medicaid expansion. This could impact millions of folks, right, who are on Medicaid right now. So I think that could happen, obviously, at the state level. I think marketplace subsidies, they could be impacted, right? I think that they could be reduced, restructured, could make coverage less affordable. This could impact folks. Short-term health plans, I do think, and this has come up, expect a continued push to expand the availability of these short-term limited duration plans. They do not give you everything that the ACA coverage standards do. It could attract healthier individuals. This could stabilize the ACA marketplace because, look, it's an actuarial play at the end of the day. So I think ultimately the approach for the new administration is going to be increased market competition, right? That's Medicare Advantage. Deregulation. We really don't know how that's going to play out, but certainly in the MA space and even managed Medicaid, and encourage these alternative coverage models. So I think that is probably the three things I would hang my hat on. And the last one being with Medicaid, pushing it back to the states, these work requirements that are going to manifest themselves in a, I think a state level way that we really don't know at this particular time.
What changes can we expect in Medicare Advantage, Medicaid?
Yeah, I think it's going to look Medicare Advantage and managed Medicaid remain stable. I think the benefits have been under scrutiny. We know this by Congress. Medicaid enrollment is projected to grow. That's not good. States are going to increase spending, so there's going to be more of a push towards managed Medicaid. We'll see how this plays out across the board, but I do think there's going to be some stability in Medicare Advantage because we can't live without it in, I think, a world where competition in the free markets and a decreased regulation is going to be the watchword of the day.
Gotcha. All right. Changing gears again, political regulatory landscape.
Your favorite topic.
Talk about Make America Healthy, MAHA.
Yeah.
The MAHA movement. So what role do you think Robert F. Kennedy Jr. is going to play as HHS secretary? Let's dig into this thing. Like, what do we know about Make America Healthy again? What's its objectives? Do we know anything right now? What can we expect to see in 2020?
Yeah, look, I'm not an expert on it. I'll go over it at a high level. But have you ever seen a incoming president, right, a president-elect, have you ever seen their Health and Human Services pick ever have this level of attention and platform and the kind of interventionist thing? It's. I mean, you don't.
No,
you
and
see
I
this, right?
want it to be that Americans are so invested in their health, but I don't think that's it.
Well, it's kind of like, be careful what you wish for, right? But look, and I'm not. We said it early. I don't think everything is bad here, and we want to be optimistic.
And I agree with the sentiment of like, I'm not going to pre-hate. I think the nation voted to see some stuff get changed up. And we see some nominations of people that they're going to change some stuff up. And I think Robert Kennedy Jr. is one of them.
Yeah. And when you think about his platform, look, prioritize the pharmaceutical industry's level of transparency. Vaccine safety. I think that's fair, particularly after COVID and everything went through with that. Now, polio, vaccines, it works. I think there's certain things that they're immutable truths and we got to stand on the side of science. But look, vaccine, that whole area, it sparks debates. I get it. I think scrutiny on the FDA, how they approve things, a push for more openness with respect to even alternative medicine practices because of Mehmet Oz and his influence is going to happen. I think chronic diseases, RFK Jr. talked about that. At the end of the day, I think there's going to be a focus on nutrition, right? Dietary guidelines. He's been all over that. Food additives, nothing wrong with that. I stand with him on that. Stricter controls on additives that are at the very least deemed harmful. We talked about transparency, not only with respect to the pharmaceutical industry, but I think on the food industry side. Policy reforms, we have yet to see that, but they're going to crosswalk to everything we just said. And I also think industry scrutiny across the board. Fraud, waste, abuse, we're going to see that Medicare. That's the only way that the Elon Musk and Vivek team is going to get at it will hopefully just be limited to the fraud and abuse side. We shall see. But I do think this year, none of this will go well unless there is collaboration, real strategic collaboration across the aisle, public engagement, professional engagement by healthcare professionals to weigh in as well. And, perhaps then we'll see more than incremental progress on the side of things that we can all agree on, like cereal that is bright red, which probably isn't natural. Right. At the very least.
And I think there's a lot we can all agree on. And if it just makes you really nervous, I mean, just go Google like a gym class in the 70s and look at the way those kids were shooting up the ropes and doing pull-ups, and then like try to compare that to like go to your kids' school and look at their gym class.
I don't even know if it's a requirement anymore, right?
It's gotten a lot. I think if you put it in the context of give it 30, 40 years, anybody on the fence about like, does this really need to be shaken up? Like, yeah, it really does.
But in fairness, previous administrations have had initiatives.
Yeah.
But nothing on the order of what we've seen here with RFK Jr. So it is, as you said, this is going to be a shakeup. If anything, the disruptive level across all of these areas that we talked about is going to be intense. The real question is, will it yield true innovation that benefits the citizenry of the United States?
Yeah.
You know, that's it. Each one of us is individuals.
And it's a weird uphill environment right now because there is this, and we've talked about this on the show, there's almost like this questioning of scientific truth.
Right.
Like you can't just say like, oh, that cereal's bad for you. Who says?
Right. Yeah.
Science. Who's science?
Exactly.
You know?
Yeah. Look, we talked about this before. You know, the source of truth, whose truth? I mean, folks having different truths, but I think in the case of, again, saying sugar is harmful in these dosages is something we can get behind, particularly if it's on a label someplace and your kid's been eating something that has been bad for them and now you have a warning. I think that's good.
Yeah, I think so too. All right. Potential fallout of the Dogecoin. I mean, Doge initiative led by Elon Musk.
Yeah, right. Absolutely. If it was the coin, that's it. You don't bet against Musk. I think that's one thing we could probably say. You know,
he's a quirky dude, but man, he gets stuff done.
You don't want to bet against this guy. I mean, I read Walter Isaacson's book on him. It's fascinating. The Department of Government Efficiency, Doge, as you said, I'm not going to get into the details, but what can they do to healthcare, particularly on the delivery side? Look, I think that funding and looking at funding cuts, fraud and abuse, waste in the VA system, in Medicare, that's the areas where they're going to probably dip their hand in. Probably on the pharmaceutical side of things, cost of drugs. I just hope that this doesn't come at the cost of delivery for folks who are on Medicare, obviously individuals who need Medicaid at the state level. These are yet to be, understood because there's no real specificity besides the fact, and it's a real fact, that there's tremendous amounts of waste and fraud in Medicare. So
what if he handled it like he did Twitter? How do you think that would go?
Throwing the sink out. I think that could be dangerous, right? I think that
Twitter doesn't have the same implications, I don't think.
It doesn't. And I've said it so many times, the difference with healthcare, and all due respect to bakers. In a bakery, we burn the bread, we can throw it out and start all over again. If you have a problem with patient care and patient delivery, rarely do you have an opportunity to establish and go back in time and start over, so you can't burn bread when you're delivering patient care.
Next topic. What do we anticipate for the investment markets?
Okay.
Venture capital, private equity, 2025.
Yeah, and don't forget, we're not giving any advice here, investment advice. This is just our general thoughts across the board. Listen, I think this is
giving advice. Dogecoin. Put all your money in Dogecoin.
That means the Department of Governmental Efficiency's coin. So look, I think this will be an important year for the investment markets. On the private equity side, activity, resurgence after what I would say is kind of a level subdued, 2023, 24. I think we're going to see some resurgence, a lot of this because of technology and where PE's gotten into businesses and they can get behind it. Cooling interest rates, that's going to be helpful. Obviously, like it or not, the stability that you can get from a Trump administration all signals very positive things when I think about the private equity side. On the venture capital side, because of technology, the innovation, the level of disruption, I think there's going to be dramatic advancements, and they are going to be spurred on by what's happening in the VC world. I think the investors are very interested in AI across all the areas where it can be delivered. And starting with the financial side and things like pre-authorization and the administrative functions workflow, all the way up to really high-end computational biology and drug discovery and the genetic side. On the M&A side, I do think that there's going to be an increase in the mergers and acquisition space, higher levels of activity because of, I think, private equity, getting behind some areas that they're very confident because of the ecosystem and, taking some chances and folks coming together in that M&A space that hopefully will be positive as well. So that is my kind of broad prediction for the PEVC space and some implications for M&A.
All right, we've covered a lot. I want to do a thing here. We're going to do a summary for 2025. I'm gonna give you the thing we've already talked about, and then you're going to give me one sentence on what we're looking at in 2025. Ready? All right, market growth.
Moderate growth, as I said. Rising costs, regulatory uncertainties that could end up being very positive.
AI adoption.
Over 60% increase in AI integration in all areas of healthcare delivery, particularly in the areas of, let's just say, workflow and some major advances in the medtech, drug therapeutic, and genetic crypto space.
Home-based care.
Continuing to increase, particularly with hospital to home and transitioning to home settings. We'll see some wearables allowing that to be more, let's just say, stable, predictable, and safer.
Policy shifts.
Wow. RFK Jr. and Dr. Oz pushing for nutrition transparency in pharma and higher scrutiny on a lot of areas that are happening in the sector across the board, but starting out on the nutrition, vaccine, and the transparency with the pharma space.
Workforce solutions.
There's got to be some investment in nursing and other ancillary areas, as well as addressing some certain medical specialties where if we don't in 2025, it's going to be worse in 26, 27, and come to roost in 2030.
Innovation.
Precision medicine, gene therapy, biotech, medtech, all on the forefront of innovation. On the low-hanging fruit side, workflow in healthcare delivery getting better because of technology deployment.
Regulatory uncertainty.
I'm going to look on the bright side and say a regulatory environment that allows for innovation and venture capital and infusion of money in that space is going to spur on some really cool innovations that hopefully could be commercialized in 2025, but certainly in the following 5 to 10 years.
I think it's right to look on the bright side. I mean, how much lower can the public trust be at this point?
Oh, wow. Look, rebuilding confidence in the system, right? In the sector, that's going to be paramount, particularly when you think about everything that happened across the sector in general and a lot of the issues post-COVID that linger.
If we were going to think about black swan events that could happen in 2025, incredible, out of the blue, 1 in a million shot, this is the year that it happens.
Wow.
What are some of the things that potentially could come up?
Yeah, listen, I'll start with an optimistic thing and say, wouldn't it be great if because of AI and technology, we had a breakthrough in cancer treatment, some kind of novel therapeutic platform that took immunotherapy and revolutionized oncology and cancer treatment in a way that really impacted, many of the disease states. That would be, I think, a real positive in that genre of black swan. On the negative side, and look, particularly with bird flu popping up now, a global pandemic, some new infectious pathogen would be really negative. That would fall under the black swan negative side.
Sure.
I also think something that's becoming more and more frequent, and we talked about on the show, a cyber attack that hit healthcare's infrastructure and really crippled everything from our supply chain to databases to confidential information. That could be very, very negative, right? I mean, that would be a tremendously bad black swan. I hope folks are preparing for that. Go back to the positive, mental health treatment. Look, we talked about virtual reality. If there could be some way we could leverage technology to address PTSD, anxiety, depression, that would be fantastic. AI, which has been a theme here for us. A black swan event could be when we could say with certainty that artificial intelligence has equal to or near human diagnostic capability.
Yeah.
Then you could say, whoa, I can scale this, and you could leap so many different hurdles that are out there.
You could put it in the hands of consumers.
Right. Real-time diagnostics in the hands of individuals in areas where there's a shortage of content experts.
I
in
just
that
hope they hire
specialty.
Hugh Laurie to play the AI bot.
Or his voice, right? I think flipping back to the negative supply chain, we saw this. This is something that's always in the back of my mind. We saw what happened during the COVID pandemic with PPE, disrupting supply chains, which could be really, really bad. Deregulation. I'm on both sides of this. I like the fact that relaxed regulations, man, a policy shift in that space could really unleash tremendous innovations. But we also have to be very wary of potential issues with safety and risks that happen with rapid market changes. That just happens. And I'll just tell you, I'll sum it up with this. There could be certainly, with respect to the labor market, if there was just folks walking out because of burnout or some policy change, they just can't take it
or just
anymore.
the increase in violence that's happening.
Absolutely. We see that where it's just like, I don't want to do this anymore. I can't do it. And particularly with an aging healthcare workforce. So that's it. Those are some black swan events. Some positive, some perhaps negative, but I think at the end of the day, Joe, that's it. So that wraps up our 2025 kind of, I don't know, what's new and noteworthy for this past week and some insights on what I think is potentially going to unfold in 2025. But for all of our viewers on our YouTube channel and our listeners on the podcast platforms, thank you for your support. Please like and subscribe. I mean, I want to thank our sponsors. That is yours truly. And with Joe's assistance, we're out here trying to put some good, relevant, valid information in your hands so that you could be, again, more of a player in the healthcare nation and have better agency over your own decisions. So, Joe, have a great holiday season, Christmas, New Year's, and I will see you again in 2025, my friend.
All right. Sounds good. Happy holidays.
And happy holidays to our listeners. The opinions expressed by the host and guests are for informational purposes only and not associated with any companies or academic institutions. Please follow us wherever you listen to your podcasts, as well as our YouTube channel, Healthcare Nation Podcast. And if you have any questions or want to contact us, please reach out to healthcarenationpodcast.com.